going to talk about swallowing difficulties that can occur as a result of a brain injury. Dysphagia is a medical term that's used to describe swallowing difficulties. Some people struggle to swallow foods and fluids and sometimes their own saliva, and other people are unable to swallow at all. So to understand what goes wrong with the swallow, it helps to understand the normal swallow process. It's a complex process that involves about 50 muscles and numerous nerves that help take the food into the mouth, prepare it, and then send it down into the stomach. We think about the swallow in 3 stages. If you think about what you do and what happens when you take a piece of solid food into your mouth, like a biscuit, or when you take a sip of water, and think about what happens. So during the first stage, the oral phase, food or fluid are taken into the mouth and prepared for swallowing. Solid food is chewed using your tongue and your jaw movements and mixed with saliva to ensure that it's a nice consistency for swallowing. Fluids are kept in the mouth during this stage by using muscles in your mouth. Teeth play an important part during the oral phase to help break the food down so that it's in the correct consistency. The person who's eating has control over this stage. The second stage, or the pharyngeal phase, is where the food and fluid are pushed to the back of the mouth using the tongue. The voice box closes off and breathing stops briefly to allow the food and fluid to pass into the top of the esophagus. The third stage, or the esophageal stage, is where the food and fluid enters the top of the esophagus and passes through the tube into the stomach. Dysphagia occurs when there is a problem with the neural control or the structures that are used during the swallow process. The kinds of people who may present with dysphagia are people who have neurological problems such as stroke, dementia, traumatic brain injury, or progressive neurological disorders such as motor neuron disease, multiple sclerosis, and Huntington's disease. Other people who may be affected by dysphagia are people with head and neck cancer, or people with respiratory problems such as COPD. Children may also present with dysphagia due to a learning disability or a congenital disorder. So things can go wrong at any stage of the swallow. During the first stage, people may have difficulties with their dentition, so they may be missing teeth or their dentures don't fit properly, which will affect their ability to chew the food. People may have weak muscles, or their muscles may not move in a coordinated manner to allow the food to be prepared correctly. If this happens and food isn't able to be chewed, it may be too large to swallow. If the piece of food is too large and it blocks the passage of air through the throat, it may lead to choking. If the swallow response doesn't occur or is slow to happen, the airway may remain open during swallowing. This means that foods or fluids can go the wrong way. Now this can happen with everyone. If you lose concentration when you're eating, if you're talking, and may lead to coughing. However, if this happens regularly because of dysphagia, then food particles and fluid particles can enter the airway and travel down into the lungs. If food or fluid particles enter the lungs regularly, then this can lead to a lung infection called aspiration pneumonia. Dysphagia can lead to serious complications and illness, and in some cases can cause death. Some people do present with signs if they have difficulties with eating and drinking. Some of these signs are really obvious, such as coughing, choking, and throat clearing whilst eating or drinking. Other signs are not so obvious, so this might include a wet, gurgly voice when talking, eye watering, holding food or fluid in the mouth, spitting food out, needing multiple swallows to clear one mouthful or one sip, and avoiding particular kinds of foods. Some longer-term complications of dysphagia may be chest infections and pneumonia, or weight loss over a long period of time. Some people may not show any obvious signs that they're having problems when eating and drinking, and these kind of people may just have recurrent chest infections that might indicate dysphagia. If there are concerns that somebody has difficulty with eating and drinking, a referral to a speech therapist is really important. A speech therapist can make the assessment of the swallow once all the correct information is collected. A speech and language therapist can assess all the stages of the swallow that may include taking different types of foods and fluids. They may use different tools that allow them to look at the person for obvious signs. They can listen to the swallow using a stethoscope around the neck area, and they can also feel the swallow. This assessment should allow the speech and language therapist to understand what's going wrong with the swallow and to be able to offer recommendations that can make the swallow as safe as possible for that person. Sometimes the bedside assessment isn't enough to give the speech and language therapist the right information about what's going wrong with the swallow. And sometimes the swallow might be too complex for just a bedside assessment. So in these cases, the speech and language therapist can refer for a more detailed test. A video fluoroscopy is a moving X-ray that allows the therapist to see what's happening in the head and neck area by giving the person foods or fluids that are mixed with barium. A fiber-optic endoscopic evaluation of the swallow, or FEES, is a procedure where a small camera is passed via the nose and into the throat, and again allows the therapist to see what happens during eating and drinking. Not all patients who present with dysphagia will be referred for these tests. There are a number of ways that dysphagia can be managed depending on what the cause is. Food and fluid can be modified to make it easier for a person to eat and drink. Foods can be made softer, so if you think about eating a biscuit versus eating a banana is a much softer texture and is easier to manage. Fluids can be thickened using a thickening powder. This slows the fluid down and allows the swallow process longer time to occur. A speech and language therapist may suggest specific head positions for a person to use during the swallow. This may be tilting the chin down during swallowing or turning the head to a particular side. Sometimes a speech and language therapist may suggest a specific technique to be carried out every time you swallow. This may include an effortful swallow or holding the breath during swallowing. These are quite specific techniques. The speech and language therapist may advise some swallow therapy. This involves exercises that can help strengthen the muscles or help with the coordination of the muscles that are used in the swallow process. Sometimes the speech and language therapist may recommend that the person is unable to eat or drink. This is known as nil by mouth. This might happen if the risk is too high for food and fluid to go the wrong way and enter the lungs and cause infection. If the risk of eating and drinking is too high and it has been recommended that a person is nil by mouth, then alternative forms of nutrition and hydration need to be considered for the person. These might include a nasogastric tube, which is an NG tube. This is a tube that's passed via the nose into the stomach. This allows hydration and nutrition to be given straight into the stomach. This procedure is generally done via X-ray and needs very careful monitoring, so is generally only ever carried out in a hospital setting. Percutaneous endoscopic gastrostomy, or PEG, is where a tube is passed through the abdominal wall straight into the stomach that allows for hydration and nutrition to be delivered that way. This is generally used as a longer-term measure if somebody is not going to be able to eat and drink in the future. Each person who presents with dysphagia is individual and they require individual assessment and management plan to ensure their safety when eating and drinking.